Associates. I'm working with Dr. Spivak.
Okay. And so you have private patients, and is this the bulk of your private clientele, ADHD or?
It's not. It's all over.
Okay.
The thing is fascinating that when I evaluated kids and parents come, when I ask all the questions about their childhood behavior and everything, and when we diagnosed them ADHD, then the parents who has been silently suffering didn't have any clue what they're going through, what they go through while they're child. And they make again another appointment with me. Okay, I think that I have ADHD. Other day, I was listening to you. I went through the same thing. I didn't know that I have ADHD.
What do you say to, because so many of these symptoms we can easily react with, it's normal, or I am anxious, or I mean, so much of this is, so few of us have an opportunity to talk to a clinical professional, and so many of these are what we consider sort of normal problems with life in general.
I think that we have to make the awareness of these symptoms of this disorder to the teachers, social workers, and healthcare professionals,
daycare workers.
So the people get attention is the boys hyperactive, they get more attention, but inattentive part get undiagnosed. So if we give them some tools or educate them about this illness, that for the girls, when they develop anxiety, to explore more about, ADHD component, see what is the root of this anxiety, what is the root of, to get detailed history, and keep in mind about could be ADD, attention deficit disorder, which is not hyperactive type, but inattentive type could be the cause. If we have that things in mind, we can easily diagnose that, we can treat it properly so that they don't suffer.
Is it genetic?
It's genetic.
Can you learn a behavior disorder?
Yes, but this is not only the genetic component. Genetic component, yes, but environmental factor is also a cause. Other comorbid conditions, other associated factors, trauma, and those can aggravate these kind of symptoms.
So what we're really asking a parent to do is be up with medical literature, up with symptom presentation, then have the courage to see a professional, and then have to talk about medication as a way of treatment of this disorder.
Yes.
It takes a brave parent. You're a parent yourself.
Yes.
Yes. Raising two children.
Raising two children, and I maybe sometimes think about is my kids is having that?
Sure. Or am I just reacting badly? Well, let's talk about then the medication, because you've made a point about misconceptions of potential stimulant abuse. This is every parent's fear about medicating a child. Is it the right decision? How is it monitored?
Because of the misconceptions, usually the therapeutic dose we give for ADHD is not that high enough to make people feel high or euphoric. So if they don't feel high or euphoric, they don't develop the tolerance and they don't have the craving. And if they don't have the craving, they don't develop this addiction. So therapeutic dose, if they take it on scheduled time, and they don't have to look for, usually they do well. But people who usually abuse drugs, most of the people's maybe not was treated for ADHD, and they abuse all the street drugs. And street drugs, the stimulant they use, amphetamine they use in different way to get very high. And to feel high, you need 10, 20 times higher dose to get the high.
This is also a condition that is chronic, but it is medicable.
Yes.
And medicated kids are going to look for a happy, healthy, productive life.
Yes. Not only the medication, you need a regular follow-up with your psychiatrist, and also some counseling, education.
With family, I would assume,
family,
too,
yes.
because this can have a huge impact on the dynamic of the family. Well, we said we want hours to be able to talk about this. This is a condition that's written about in every national magazine, and to have somebody of your caliber talk about the real deal here has been just a real treat for Health Focus. Dr. Aleya Karim, an child and adolescent psychiatrist. Thanks so much for joining us on Health Focus.
Thank you.
We urge anybody to, if questions, call somebody professional, see a professional. If either a child or their own behavior raises questions. Again, thanks for all of your straightforward advice today. You've been watching Health Focus, and it's produced by HCA, the Hospital Corporation of America, with regional and local facilities, including Reston Hospital Center. Health Focus gives us the opportunity to talk to medical professionals, talk about subjects that are important to you, and we're so glad you joined us for the program, and we'll see you next month. This is Ann Rodriguez, your host.